My name is Bethany Mlodoch, and this is my Week 7 persuasive presentation. I have chosen a topic close to my heart, which is, should youth soccer programs be allowed to have heading in the games and during practice? If you are unfamiliar with the basics of soccer, the rules are, except for throw-ins, players other than the goalie cannot use their hands. Although players typically use their feet to move the ball and advance play, heading is another key element in the game. Luckily, all players are required to wear shin guards, socks that cover their shin guards, and cleats. Jewelry is also not permitted in the game or practice. What is heading? Headers enable the player to pass, clear, or shoot the ball with their heads. The research on heading in soccer is both limited and mixed, with some studies showing no repercussions. However, others have linked this to concussions and other neurocognitive impairments. Ultimately, it needs to be decided, is it worth it? A concussion is a mild traumatic brain injury that may or may not result in a brief loss of consciousness. I work with the CDC, and I'm always extremely happy with their level of detail and thought into sharing important information with families about healthcare. This is also including healthcare for sports. To help ensure the health and safety of young athletes, the CDC developed the Heads Up Concussion in Youth Sports Initiative to offer information about concussions to coaches, parents, and athletes involved in youth sports. The Heads Up initiative provides important information on preventing, recognizing, and responding to a concussion. I've included a link here to a helpful fact sheet from the CDC for parents to help understand the important information about concussions. Since I wasn't able to include this for the video, I will have this as a separate link with our Blackboard discussion. The U.S. Soccer League suggests that any league that combines 11 years and 12 years under not allowed heading in the game. For youth soccer, kids are to practice and use the size ball that is recommended for their age group. This is important because even with not having headers in the game, there is always the risk of the ball making contact with their heads during the game. The risk of a head injury is comparable to other contact collision sports. Though evidence does not support repeated heading is a risk for short or long-term cognitive issues. However, to reduce the risk of injury from heading, as I mentioned, players should be taught with the proper size soccer ball. Personally, I do not believe that heading should be allowed in youth soccer. It's not worth the risk. Heading should not be done in youth soccer until there is more known about the effects on the brain. Also, no recommendations regarding the use of helmets or cushion pads to reduce head injury in soccer can be made at this time. I think there needs to be more research and established safety standards and regulations before they proceed putting this into a youth program. My oldest daughter Maddie plays soccer for the Schaumburg Athletic Association. She has been playing for the last 5 years, and I'm extremely happy that they do not allow heading in our youth soccer program. Having my daughter in soccer is about keeping her physically active and learning about sportsmanship. She enjoys playing and she's competitive. However, I do not want to see the side effects of playing soccer at just 10 years old having permanent side effects and/or brain damage from heading in soccer. I personally do not need to wait for the research to describe the effects. I think there is enough evidence to want to prevent any possible damage to the brain, especially during her adolescent years. This is my daughter, Madeline, playing. And just more about this presentation, I wanted to take a personal story into this persuasion presentation because I think sharing a personal story helps connect with my audience, and hopefully this connects with you and resonates with you, and if you have children in youth sports, that you do the research and understand what could happen in any contact sport. Thank you.